Hello viewers, welcome to today's episode. My name is Dr. Adwoa Agyei-Nkansah, a consultant physician, gastroenterologist, hepatologist, and a lecturer with the University of Ghana School of Medicine and Dentistry. Today we're going to look at the overview of viral hepatitis. Now, hepatitis is made up of two words. It's a Latin word, hepa, meaning liver, and itis, meaning inflammation. So when we say hepatitis, we mean inflammation of the liver. So we're looking at what are the things that will cause inflammation of the liver. One of the common causes of hepatitis in our part of the world or in Ghana is the viral hepatitis. We have hepatitis A, we have viral hepatitis B, viral hepatitis C, D, and E, etc. But per this presentation, I'm going to limit my overview to hepatitis A to E. Now we'll look at the various ways in which they are acquired and how they present, how we do the investigations, and how these viruses are managed. When we take hepatitis A, we say it causes acute hepatitis. And acute hepatitis means that when you get it, you are able to clear it. It doesn't linger on for the rest of your life. Hepatitis A is usually caused or is usually acquired through oral fecal means. By oral fecal, what we mean is that when one ingests or takes in contaminated food of somebody who has hepatitis A, because it is excreted in the feces of an infected person. So when this infected feces gets into contact with food and one takes in the food, one gets exposed to hepatitis A virus. Now, how will somebody present? They will present initially with severe weakness, body pains, nausea, vomiting, and then jaundice. Now, with hepatitis A, to know the history, or when you ask the patient, it may give you an idea if you are dealing with hepatitis A. Per the lab investigations, we take blood, about 5 to 10 mils of your blood to the lab. And then they do what we call hepatitis A IgM. The IgM gives us an idea that this patient has an active virus infection. So when your IgM is positive for hepatitis A, we say you have acute hepatitis A infection. And with hepatitis A, management mainly we say is symptomatic, depending on the symptoms. If you are vomiting, we make sure we give you enough fluids so you don't get dehydrated. And then we are giving some vitamins to boost your appetite. Bed rest is very important. Now, the liver is plays a major role in digestion of the food we eat, mostly the fat and the proteins. So when somebody has hepatitis, when the person is so ill and jaundiced, we ask the patient to stop taking oil foods, and then we also ask them to reduce or stop the protein. But this is just for a short while when they are jaundiced and severely ill. As soon as they get over the jaundice and is cleared, they go back to their normal diet.